Probably happens more often than you would like to think or consider, but nonetheless, this is why it's important for us to be in tune to our oxygen therapy, have an appreciation for our air entrainment devices. You've also got air entrainment ratios that you can go off of and what have you. So what you see here is you've got an individual that is receiving supplemental oxygen via a tracheostomy collar. So you can see that tracheostomy collar does indeed cover the tracheostomy tube. So the idea behind applying this aerosol to the patient is so that it helps provide moisture to the inspired air, the inspired gas that patient's going to be taking in. We can also see that the FiO2 setting on that is at 40%. When I say FiO2, that should mean the amount of oxygen that this patient is inspiring through that tracheostomy collar. So it would be better served to say that on the actual air entrainment bottle, the large volume nebulizer that we have set up there, the FiO2, the delivered amount of oxygen, is set to 40%. Because if I were a betting man and I used an oxygen analyzer and I placed that oxygen analyzer here, proximal to the patient's airway, I would be willing to bet that that's not 40% coming through this system. Why is that? Well, we've got some troubleshooting things that we've got to look at. We do indeed have an FiO2 set at 50%, and that flow meter is pretty well maxed out. It's running, calibration looks like that's between 13 and 14 liters per minute. But I want you to pay closer attention to something that I encounter quite frequently throughout my oxygen rounds when I'm checking on patients in the hospital. So notice we've got water coming out of that entrainment port. That's going to be important when we get ready to talk about this next little bit. So I said the FiO2 is set at 40%, and I told you that I would be willing to bet you some money that the FiO2 going to this patient is not 40%. Reason being is because if you'll remember, you can have some issues with downstream obstructions, and with this being aerosol, that aerosol is this particulate water that's going to bounce off of this corrugated tubing, and it will fall out of suspension and it will collect. So if you take a closer look at the setup here, you can actually see that there's water bubbling there. If you're a respiratory student, have you ever gone into a patient's room and noticed this with a tracheostomy tube collar set up or what have you? If you're a registered respiratory therapist, have you ever noticed that? Have you paid, hopefully you've been nice enough to drain everything back. This aerosol drainage bag, first of all, the individual that set that up looped that around, so naturally we're going to collect that. And that aerosol drainage bag should be set at the lowest point so that gravity can do what it's supposed to do and allow fluid or water from both sides of the corrugated tubing to drain into this drainage bag. And also make note that you need to make sure that you cap that bag. Because that would allow that water to run out onto the floor, and then it may be a fall hazard. But nonetheless, and we can also notice here that some of that water has now collected because this instance is not higher than where the bag is, so it's not able to drain effectively. Well, one of the troubleshooting things that you might encounter for an exam purpose is if you've got water collecting in your corrugated tubing in a air entrainment setup with a tracheostomy collar, what happens? And the answer choice is likely going to be the patient's FiO2 goes up. But I want to share with you that just so that you understand what's happening. We have roughly 14 liters of 100% oxygen set coming out of the wall through this flow meter. This orange collar is dialed to 40%, and this window is opened up. That should suck in enough room air, which is at 21%. So if we mix 21% oxygen with 100% oxygen, we should, based upon the calculation of how that window is set, have 40% delivering through this system. We also know that, and let's just make this 10 liters so that it makes math a little bit easier. But we also know that at 40%, the air to oxygen entrainment rate is a 3-to-1 ratio. So that means for every 1 liter of oxygen coming through this flow meter, this window has to be able to entrain 3 liters of air to be able to make that 40% going to the patient. And that's going to give us, so if I have it set at 10, based upon that 3-to-1 ratio, you can add those two ratio parts together, multiply it by that liter flow, and get a total flow. Or if you want to break everything down, for every 1 liter of flow of oxygen, I have to match that with 3 liters of air to maintain a 40% FiO2. So if I have that 10 liters of oxygen set, then 10 times 3 is 30. But if you're asking about the total flow, you've got to add that 10 and 30 together. So you have a total flow of 40 liters per minute coming through this system. Let's assume that that is meeting or exceeding this patient's peak inspiratory flow demand. What happens when you have an obstruction downstream, as in water collecting in the corrugated tubing? That causes a back pressure to build up. So back pressure builds up, and you can see that water is flowing out of, or being bursted out of that window. That is the entrainment window. Air should be going in, but because of the back pressure that's built up, now essentially all that we have going through this to the individual is roughly that 10 liters of oxygen flow. And if there's not as much air being entrained, the FiO2, or the amount of oxygen that's getting delivered through that system, is going to be significantly higher. But we can't guarantee that the FiO2 for the patient is truly higher, because you got this port here and you've got the air around there. We don't know how much they're breathing, and we want to meet and exceed that patient's peak inspiratory flow demand. So water collected in a drainage tube is going to cause your total flow through the system to go down. It will cause an increase in the percentage of oxygen that's getting delivered through the system. But you'd have to kind of guess at what it's doing to the FiO2, because if I can guarantee 40% with 40 liters here, but now because of the back pressure due to the water, we've already explained how we're not entraining air, so that knocks the total flow through the system down to probably just the 10 liters of 100% oxygen going through here if we're not entraining the air. So it's really hard to guess what that FiO2 would be, but you're going to see that it's going to test questions that will say that it increases your FiO2, decreases the total flow, and so forth like that. You need to understand the difference between delivered oxygen and what the actual fraction of inspired oxygen is. But hopefully you can see the problem that would occur if you have some water that collects in this. So always make sure that you drain that down to the drainage bag, and have that drainage bag in the lowest point possible. And now that I've drained and removed the water from that, you can see that there's significantly less water being spurted through that window, and the sound is different because it's now entraining more room air to mix with the 10 liters of 100% oxygen coming through. So now we have 40 liters of 40% oxygen making it to this patient. And that's super important for us to have an appreciation and understanding for. Thank you for your time and attention.